Okay. Good morning, everyone, and welcome to this amazing Mother's Day weekend special talk, Cool Women, Hot Flashes. My name is Vaibhavi Haridas, and I'm the founder and president of Arva Yoga. Arva Yoga is a non-profit organization, 501c3, established 5 years ago during the COVID period to offer free yoga and wellness to the community. Since then, we have had tremendous support from the community as well as amazing volunteers and presenters who have presented several topics on the platform, including yoga and special topics like the one we have today. Today's topic is focused on women's health during menopause, perimenopause, and post-menopause. And it's an honor to have two incredible MD doctors who have done their MBBS and MD and have been practicing in the United States, Dr. Minal Dhamankar and Dr. Manisha Kamat. I'll begin with brief introductions for both of them. Dr. Minal Dhamankar, she's a hematologist and oncologist at Jefferson Health with 13 plus years of experience in the US. Beyond medicine, she's deeply involved in the community initiatives, breast cancer awareness projects, and creative arts, including writing and watercolor painting. Dr. Manisha Kamat, she's a psychiatrist with 25 years of experience specializing in innovative mental health treatments. She's also an award-winning playwright, performer, and advocate for emotional wellness. We are super excited to learn more about this very incredible topic that definitely affects all of us, whether you're a man or a woman, joining us on this session today. I had an opportunity of meeting both these women on another group, and when I saw this session, I thought this would be a perfect fit. And once again, big gratitude and thank you to both Manisha and Minal for joining us today. I'll be speaking more about Arva Yoga at the end of the session, but now we are at 10:04 and I'm going to start sharing my screen and we'll begin with our topic of the day. Okay.
So good morning, everybody. My name is Manisha, and so thank you, Vaibhavi, for on behalf of Minal and I thank Vaibhavi and Arva Yoga for giving us this opportunity. And happy Mother's Day to all of you. I do not believe personally that Mother's Day should be limited to a particular gender because it should be celebration of motherly instinct in us. So whether you are a man or a woman, if you have motherly instinct, I believe it should be celebrated. So happy Mother's Day to all of you, and I appreciate that some men and women are joining this topic because it is important that everybody is aware of what's going on with a woman in the house, so that the household stays stable. And so we are going to talk about that. So the topic is hot flashes and cool women. So next slide, please. We are going to go over some of the myths and facts about the menopause. We'll go over that and then we'll talk about particular, in depth on menopause. So menopause happens overnight. Next slide. It doesn't happen overnight because, as you know, this is next slide, please. Yeah. It's a gradual process and it's a transition that can last from 2 to 10 years, So if you are in 40s, sometimes even late 30s to early 50s, it goes on before actually the period stops. So this is like a perimenopausal process that starts. And then after you have like a 1 year of having no period, that's when you are actually a menopausal or postmenopausal women. So next slide. You can't get pregnant once symptoms start. That's a myth because though the hormones are fluctuating and fertility is declining, pregnancy is still possible. I'm sure some of you have watched that Hindi movie, Badhai Ho. So just be mindful, though you are menopause or or perimenopause, pregnancy is a possibility. So use caution. Weight gain is inevitable and permanent. It can happen that, because of the metabolism slows down with age and hormones shift fat to the midsection. And because of that, the shape of the body can change, the muscle mass can change. So proactively, doing strength training, yoga, focusing more on nutrition to manage body composition changes is very helpful. You just have to tough it out. I mean, probably generation before us or our grandparents' generation, that people were not much aware and people were afraid to talk about it. So the in general, the sense was, oh, tough it out, but that's not true. You don't have to suffer. There are so many science-backed treatments that are available. Some of them include medications, some of them are just lifestyle modifications. So we'll talk about those as well. So again, I'm going to hand it over to Minal now, but today's session is just for as a conversation, informal conversation about spreading awareness, but it is not a particular individualized medical advice. So if you need anything in particular, please reach out to your healthcare provider. So with that disclaimer, I'll hand it over to Minal.
Hello, thank you, Manisha, and thank you all of you for joining today's session. And thank you, Vaibhavi, for giving us this opportunity to have this discussion with everybody. So, as Manisha mentioned, the goal of today's talk is to make you feel empowered. Like, we don't want you to suffer in silence when you hit menopause. This is not a disease, it's a natural phase of your life. It's like celebrating a 12-month anniversary of your last period. At the end of this talk, we would like you to know what are the common health issues that you can encounter during this phase, know the symptoms that you should bring to your doctors and have discussion about it, and gain tools to advocate for your own health. Next slide, please. So, as a woman, change is constant in our life, and broadly we can divide the 4 stages in a woman's life into puberty and adolescence, reproductive years, perimenopause, and post-menopause. Each life phase, as you all very well know, has its own health issues, health priorities, and these phases are mainly orchestrated by hormones. Next slide. So, what are these hormones? We keep hearing about hormones all the time. So, these are, I usually think of them as body's messengers. These are chemicals that are made by our body and they are involved in head to toe. Actually, they affect a lot of our body functions. And there are different types of hormones that control your sleep, control your growth, stress management, blood pressure management. And these are very dynamic. Any change in your body, in your life, can affect them. Like when they change with your age, you have more stress, then the hormones can go haywire. You're not getting enough sleep, you'll have more hormone production. Pregnancy, of course, there are major hormonal changes. Any other illnesses can also affect hormones. So there, as I said, there are different hormones: thyroid, cortisol, insulin. But for today's talk, we are going to focus on the female hormones, called mainly the estrogen and progesterone. I've mentioned testosterone here, which is a male hormone, but it also plays a role in women's health. So I just thought it deserves a mention. So next slide, please. So going back to the 4 phases of our life that I mentioned, So when we are born, the hormone levels, the estrogen level is at its lowest, and it starts rising as we get into the puberty and adolescent stage, which is between age 8 to 18. And that's where we start developing bodily changes like breast development, development of pubic hair, or acne formation. Then these hormones continue to rise, and during the reproductive years, they play a role in childbearing, conception, pregnancy. And then as you hit late 40s, these hormones the hormones start decreasing. That is the estrogen and progesterone. They start get their downward course in life. And this can even start as early as 35. And this phase will last for 7 to 10 years. And now in this graph, I've shown like a smooth curve, but that is not what actually happens. The hormones will keep fluctuating. When they start decreasing, there will be days when they're at the lowest, and they will suddenly rise, and they keep fluctuating till and that is the fluctuations is what causes your irregular periods, your all other menopausal symptoms that you experience. And then finally the periods stop, and till then the hormones keep fluctuating. And then for 12 months, if you do not have your period, then that's when you are technically like by definition in menopause. And so average age of menopause is 51, but the range is 45 to 55, can happen anytime. And then after you reach menopause, that's when the hormones will even out, and the symptoms then start getting better. And so the rest of your life, that is the last 1/3 of your life, you're in post-menopause. Next slide, please. So, what are the symptoms that you typically experience during perimenopause? So, the most common thing that we hear as physicians is, I just don't feel like myself. And that is exactly what happens, because there are multitude of symptoms, like almost 80 plus symptoms have been reported in the literature that you can see due to these hormonal fluctuations. And unfortunately, there is no blood work. And because you cannot really pinpoint what is exactly happening to you, it oftentimes gets very difficult to seek help or ask the right questions to your doctors, because you yourself don't know what's happening. So next slide, please. So we can talk about a few common symptoms like hot flashes, where you're like having sudden heat waves that you want to jump into the fridge. Night sweats will keep you awake during your life, during your sleep. And then your body gets really intolerant to heat or cold. One minute you are feeling very hot, the next minute you want to grab a blanket. And then the common theme of, I'm just fatigued, I'm just tired all the time. That's a common thing we hear. Next slide. And then the lot of psychological symptoms, brain fog, which Manisha will be covering. So I'm just going to skip this. And then in addition to the symptoms, you also see your bodies change again. So you see you're gaining weight more around your midsection. Your hair starts thinning, your skin is dry, and then you want to work out to lose your weight, but then your joints are hurting. So it's like catch 22. You can't win either way. And then because you're not exercising, you're not moving around much, you start having balance issues. You just, there are other like blood pressure issues. You can feel like your heart is racing fast. Muscle mass reduces. Vaginal dryness is something that you don't feel comfortable about talking with anybody, but it's a true symptom. There is increased risk of urinary tract infections. Next slide. So I mentioned that the symptoms decrease after you reach menopause, but in the post-menopausal phase, there are some serious health risks which also we should be aware of, and heart disease. I mean, we always hear that women don't get heart attacks, women don't have heart disease, but that's not true. In fact, in postmenopausal phase, the women are equally or sometimes even more at risk of developing heart disease, and that's still a major cause of death in women. Osteoporosis, your bones start thinning out. Metabolic syndrome, which is a combination of high blood pressure, diabetes, and cholesterol. You start seeing those things also in this phase. Certain musculoskeletal disorders like frozen shoulder, plantar fasciitis are seen in this age group. Um, Cognitive brain issues, the worst case is dementia. Not so common, but can happen. And of course, sleep disorders, depression. And last but not the least, certain type of cancers, breast, uterine, ovarian are more commonly diagnosed during this age group. Next slide. So, what are the things that you can do to help yourself? So, nutrition goes a long way, like um, protein dense, like or nutrient dense food is something that you should be focusing on. Hydration is important, and movement is very important. It kind of takes care of a lot of the things that I mentioned. I mean, your balance issues, your weight loss, general mental health. Also, it goes a long way. Having a good night's sleep helps in the hormonal control, hormonal balance also. And then like doing things that you like have some hobbies. This is the time to just spend more time in doing what things that you like, mindfulness and stress reduction. And then if you do have metabolic disease, it's not wrong to seek help or bring it to your doctors and take medications in time rather than wait for some emergencies. And then brings us to the hormone therapy. I'll talk about it in the next slide. Yeah, so the hormone replacement therapy, this is, there are a lot of controversies on this topic about should I take it or should I not. And the latest update is that it is safe for some women. So it's an individualized approach. So you should be talking to your physician if it's good for you. Other things you should be doing is like routine health checkups, like we service our car every year or every 6 months. So your own servicing is equally important. And the finding a provider who will listen to you or participate in your healthcare decisions is crucial. You can ask when you see your physician and you're experiencing these symptoms, it's good to ask them that can my hormones explain my symptoms? Are there any treatments that you can recommend, and what lifestyle changes might help? And the routine things that we check during the health visits, blood pressure, cholesterol, diabetes screening. This will help us know if you are developing metabolic syndrome and if things can be done, if something can be done sooner till it really progresses and you can avoid medications. DEXA scan or the bone density scan, usually it starts at age 65, but in certain health, if you're on some medications, then it can be done even earlier. So that should be also discussed with your physician. And then there are vaccinations for age 50 plus that the physician will recommend. Next slide. And then cancer screening. We all know early detection saves lives. So mammograms starting age 40, colon cancer screening starting age 45, and pap smears every 5 years. And then mental health, Manisha will be talking about. And then what you should not be doing is not to ignore your symptoms. like, don't assume that they are related to, I'm just getting old, or I'm just so busy, I'm burning out at my work, and that's why I'm experiencing all these things. Don't assume. No symptom is a silly symptom or a silly question. Bring it to your doctor. Don't be a Google doctor yourself. Don't suffer in silence. I mean, it's normal to go through these changes, but it's not normal to suffer in silence. So these are some resources where you will find information on this phase of your life. And then I give back to Manisha. Thank you.
Thank you, Minal. So hi everyone. We'll talk more on the mental health aspect of menopause because healthy mind and healthy body go hand in hand. So Minal talked more about the body, but at the same time, she did touch upon some mental health symptoms as well. So we will go in depth about those symptoms. So next slide, please. So with the menopause, it's more like, filly weather. I don't know, most of you are maybe joining from this local area. So the weather is, sunny today and cloudy tomorrow and then raining and then very cold. Menopause is just like that. You get mood swings and anxiety and low mood and brain fog. And it can happen during the day, in any given day, things can change, so you wake up feeling good, but then there is anxiety without any reason. Then end of the day, you start feeling low. Then you question, why am I feeling like this? Good. Overall, the day was pretty good. But then, things, some people, I have had some people who have had crying spells even without any reason, and then they start wondering if they are going crazy. Sometimes brain fog is one of the symptoms where you open the refrigerator thinking, oh, I need to take out something. You open the door and then you forget what it is, or you go to a particular room in the house to get something, and then as you enter that room you totally forget what you were there for, or losing your car keys I cannot find. So that's the symptom of brain fog. Sleep issues because of the hot flashes. Many women wake up in the middle of the night feeling extremely hot, though it is snowing outside. They are just burning hot, and then they are not able to sleep. Sometimes, once you are awake in the middle of the night, then the racing thoughts start, then the whole cycle of anxiety starts. And because you are sleep deprived, that adds to your fatigue during the day. You are trying to push things through to function at work and function at home, but then fatigue gets in your way. So all these symptoms are real, common, and absolutely valid. So please acknowledge those symptoms if you are experiencing those. Next slide, please. So Minal did talk about the hormones, the estrogen and progesterone. I look at these hormones, as like the backstage crew. So we don't see them to our eyes, but they are basically controlling everything. They are controlling your mood, they are controlling how you manage stress, what kind of smallest things can make you feel very, very stressful, or your sleep. So, and during menopause or perimenopause, during menopause, these hormones are fluctuating all the time and they are rearranging themselves, and that's why the show gets very, very interesting. Next slide. So it's I want you to think like an assembly line, So when these hormones, the estrogen and progesterone start fluctuating, that affects the neurotransmitters in your brain, like serotonin and dopamine. So in the production, if one thing gets affected, how it impacts the whole production, in that cycle. So it starts affecting the neurotransmitters like serotonin, norepinephrine, dopamine, all those, other chemicals in the body, which we cannot see, but we experience the symptoms. We see the changes, in mood and sleep because of that. Then there are life stage stressors, because usually when we are talking about age range from 45 to 55, we are dealing with aging parents. If you're away from your parents, the distance makes it difficult still. One part of our mind is in India, for example, and you are here, you're trying to manage things here. Children are leaving the home, or you're busy with their activities, running around with their college visits, or participating in their after school activities. So it makes life very, very difficult. We are like the sandwich generation. You are providing for older parents as well as providing for the younger generation. So that takes a toll on our own health. Then sleep disruption because of the hot flashes we talked about, and then past mental health history. So I just wanted to talk a little bit about that. If someone has had history of anxiety or postpartum depression, or in general, everybody has different personality traits. There is nothing right or wrong about the personality traits, but if someone has very perfectionistic tendencies, or someone is little more anxious than other people, those people are more vulnerable to having these mood symptoms. So if you have past history of mental illness, or if you have noticed that you are more vulnerable in certain aspects, pay more attention to your symptoms, and we'll talk a little bit more about that. Next slide. So what are the do's? Of course, we are on this Arva Yoga platform. So move your body is the key thing. Different yoga poses, or, running, walking, all those things are definitely helpful. Eat real food. Because we are so busy and fatigued, people tend to eat something fast, quick, just microwave something. I don't see, so stick to that, stick to eating real food. Eating real food means, maybe colorful foods are always good, beetroots and carrots and spinach. So it makes the plate also look beautiful, and then it helps with our iron level and fiber and all that. So just eat real food, stay cool. And by stay cool, I mean, stay actually dress up that in a way where your body temperature is maintained. So that if you have hot flashes, you can remove your dress in layers, and then stay cool. Stay up with your what's going on in the environment. Stay up to date with what's going on around you, so that it helps your self-esteem as well. Practice calm. There are so many apps nowadays available. If you are able to do pranayam, and we are again on this yoga platform, that's great. If even for short period of time, if you get 3 minutes in between, during your lunch break, if you are able to practice calm, that's good. There are so many apps available, like Calm app is good, or Headspace is good. Being mindful when we are eating, even, rather than scrolling on the phone, or, doing some watching TV, try to be mindful, try to enjoy the moment. That also helps. Talk to people around you. We tend to get very isolated. The way work-life balance is at this point, and people are so focused on social media, so they may have like 10,000 followers, but they feel alone. So talking to real people is definitely helpful. Sleep smart. Again, dressing up, just maybe wearing something very light clothing, or there are mattress covers that are available, which can be cooler. These are available even online, or Costco, and they are really helpful. People who suffer from hot flashes at night, just changing your bed cover, that can be very helpful to help with the sleep. Changing the room temperature, sometimes Um, just adjusting the thermostat to like 65 or so may be helpful. Talk to your husbands or your bed partners about this. That way they are aware, and you can avoid any kind of argument in the middle of the night that you are going through these bodily changes. They can wear sweaters, and you can wear lighter clothes so that both of you can get enough sleep. Next slide, please. So what are, again, talking about what we can do, the practical advice. First of all, acknowledging our symptoms and then monitoring our symptoms. What time of the month do I experience this? If you track your symptoms, everybody has their bodily calendar. So just say before the period, about a week, I start experiencing these symptoms more. So then if you are aware that these symptoms happen during that particular period, you can let your family know. This is you can make jokes about it. This is the period, this is the time frame when mom is going to be a little more, iffy, or, a little more. So handle with care, during that time. So try to seek support and help from your family so that they are aware and they can help you stay calmer, during that time. Build a feel good routine. If you want to start your day with meditation or yoga, or scheduling a spa day, or cultivating your hobbies, because all these years leading up to this, we have focused more on building our career and building the home. Now it's our time to look back and say, okay, what can bring me enjoyment? I have given so much. What can I do to nurture myself? And music, walks in the nature, if you like writing, whatever it is, talking to people, cooking, it can be very, very therapeutic. Seek help when needed. As I talked earlier, at any point of time, people can need, mental health support. It's not a sign of weakness. So definitely do seek help. I'm just going to just elaborate a little bit on that, because there is so much stigma associated with mental health. People almost feel like somebody is almost, making them feel this way, or they are intentionally feeling anxious. Oh, just don't think about it, or, it's all in your head. So it's not like that. I can use the example of diabetes. When your insulin is not secreting enough, or when your pancreas is not secreting enough insulin, your blood sugar fluctuates, and then you're diagnosed with diabetes. Do we tell our pancreas to secrete insulin? Do we say, oh, what's the matter with you? Just secrete more insulin. We are more empathetic towards that person and say, oh, poor thing, that person has diabetes. From outside, the person looks fine. It's their the insulin level that's low. Here in the brain, if your serotonin or dopamine level is fluctuating, you experience certain symptoms. But in the society, many a times people feel, oh, this symptom can be easily controlled by that individual, and that's why it is looked at the sign of weakness. But that's not true. Neurochemical imbalances can manifest certain symptoms. So just be aware of that. If you are experiencing particular symptom, just seek help. And when do you seek help? That so if somebody, if there was a life event, there was something stressful happening, job loss. Of course, people are going to feel a little anxious. People are going to feel sad because we are gifted with emotions. But if these symptoms last for more than 2 weeks consistently, where you cannot function, you cannot, concentrate in anything else, you cannot distract yourself from those symptoms. It impacts your appetite, it impacts your sleep. Those are the warning signs when you should be seeking medical advice. Okay. Now, be kind to yourself. We tend to push ourselves so much, which is to an extent good, but we don't want to push to a level, where we can break apart. We don't want that. We want to go to our optimum level of functioning. So pushing yourself is good, but then being kind to yourself is important so that you don't break that balance and you don't come down. All right, next slide, please. So don'ts during the menopause, do not ignore persistent sadness. I talked about that, or anxiety, or somebody having panic attacks in the middle of the night. I have seen patients after hot flashes having panic attack. They feel like they are about to die. It can mimic almost like a heart attack, pressure on their chest, palpitations, sweaty palms. If you experience like this, definitely seek mental health professional. Don't isolate yourself. Or talk to your friends, people. We are talking about this now. Talking to your friends who may be going through similar symptoms. Talking to your partners, your spouses, your children is very helpful. That it should not be a taboo where it should be hush hush, and not be. It should not be discussed. It's a biological thing, natural thing that is happening. So talking to everybody and educating everybody around you is very, very helpful. Don't rely heavily on alcohol or caffeine or smoking. Sometimes, people, I do see this a lot in my patients, people are not able to shut down at night time. So they drink alcohol to help them feel calmer. Then they wake up feeling a little hungover or tired. Then they drink coffee. So then that vicious cycle just starts, because they are heavily caffeinated, they cannot sleep, fall asleep, so then they rely on alcohol. So just try to avoid those those symptoms or cycles. Don't assume symptoms are just aging, though, I mean, it is process of aging. So accepting some part of aging, we are not going to look like how when we were 20 years old, but there are going to be certain limitations. But at the same time, exercise and strength training will help. Don't push through severe sleep deprivation, because that will again start the stress or release stress hormones, and then it will just impact your mind as well as your physical symptoms, bodily symptoms, because sleep helps us to rejuvenate our body as well as mind. So take sleep very, very seriously. Next slide, please. All right. Enjoy your second inning free from the period, and no more cramps, no more red dates on the calendar, and you have graduated from the monthly cycle. So now enjoy the freedom. And I will open up to Minal as well. And thank you. Thank you for.
Thank you. Yes.
Wonderful. Thank you so much, Manisha and Minal, for this amazing talk. At this time, I'm going to stop the recording, and that way we can share out this recording with others. I'm going to take a quick check from the participants. We have a nice little group here. Participants, if I am going to take this kind of vote on the fly, some of your questions might be beneficial for people who listen to the recording. So by show of hands or put it in the chat, if there are personal questions, I can stop the recording. If there are no objections, I can let the recording go too. So if there is anything that you want to say at this time, please put it in the chat or say out loud. I do see one question that I think would be a good one. Okay, so I do have someone who has personal questions. So let's just take this one question that seems pretty generic. Is intermittent fasting good with hormones and hypothyroid? That's the question.
Um, I can take that. So intermittent fasting, in general, has been a lot of research behind it and has been shown to be beneficial for a lot of different things. Mainly, of course, weight loss and uh, things, metabolic syndrome. It's beneficial, but also has shown like benefits in like preventing inflammation and also in cancer prevention to some extent. So overall, it is beneficial, but again, it's really an individualistic approach. Does it suit you? And in menopause, one thing that happens is that we tend to have a lot of cortisol production, and fasting, you get wake up in the morning. That's the time when your cortisol is at the peak, and that cortisol is the culprit in putting the fat in your belly region and for a lot of other health issues or even metabolic syndrome. So, with intermittent fasting, if you wake up and you're not eating till mid noon or later, then you might cause the worsening of the cortisol peak. So that's why I said that it's a really individualistic approach there, what suits you or how your body mechanism is. So you have to be a little careful in menopause with intermittent fasting. And that's why we hear a lot of times in menopause, women are doing intermittent fasting, but they are seeing no change in their belly fat or certain things that they it helped them before, but now it's not helping. So that could be the reason.
Thank you. And maybe one more question, and then we'll stop the recording for other private questions. How about low blood pressure and cortisol, non diabetic with hypothyroid vertigo?
So, I mean, is this question with respect to again with intermittent fasting?
Let me do this. I'm going to stop the recording just so that we can, once again, on behalf of Arva Yoga, a big thank you to Manisha and Minal, amazing doctors who have taken time off of their busy schedule for sharing this knowledge with the community. We'll be giving both of them a service award certificate. One last announcement before I wrap this session. Arva Yoga has a yoga festival that happens in a month's time on June 7th. So stay tuned for details via email for this particular event. And with that, I'm going to stop the recording, but the session will continue for open questions and answers.